Diagnosing, treating, and dealing with rheumatic conditions like arthritis. That is the focus of tonight's Ask the Doctor segment. Dr. Teresa Chavez is a rheumatologist with St. Mary's Medical Group. Thanks so much for being with us tonight.
Thank you.
You bet. First of all, what is the most common of the rheumatic diseases?
Well, there's a number of them that are very common, but osteoarthritis, rheumatoid arthritis, fibromyalgia, soft tissue conditions like tendonitis and bursitis.
So just regular arthritis, let's say of the hands. What is the best way to treat that?
Well, you can start with simple things like aspirin, exercise, moving your hands, heat, to kind of loosen up and lubricate the joints a little bit, and then go on to more sophisticated stuff.
Sure.
Yeah.
Is there anything out on the horizon, anything new and upcoming in the treatment of arthritis conditions?
Oh, there's a lot going on. We've had kind of a revolution in the last 10 years. We have lots of biological therapies. Lots of newer kind of innovative immunologic therapies that we're giving patients. So yes, there's a lot of new things.
So really there's no need to suffer. I mean, if somebody is feeling the aches and pains of inflammation of the joints and muscles, they really need to get in to see somebody.
Yes, they should start with, with their family physician. I think is always a good place to start because that person knows the most about them and knows what their history is. And then if it's more complicated than that, then they should come in and get a referral and be seen by somebody who's a musculoskeletal sort of expert.
You bet. How about the overuse injuries that we hear, people who have been athletes younger in their life and now they're like, oh, my knees when I get up. Is there anything that you can suggest to athletes and young kids who are doing those overuse injuries to prevent future problems?
I think rehabbing injuries is really important. Making sure that they heal up properly, taking all the medication that's being given to them to help them get over the inflammation and the pain, and also going through physical therapy if that's prescribed, I think is a good idea so they don't re-injure.
Right.
And also learning what their limitations are. Maybe certain types of activities aren't going to be good for them to do over and over again because they are going to re-injure, but they can still be active.
Sure. Okay, Dr. Chavez, we certainly appreciate your advice tonight. She will be here taking your calls and questions until 6 o'clock. To speak with her, just dial 858-2222.